Okay, friends, we're going to be doing now stretching and strengthening exercises for the shoulder. Again, not to sound like a broken record, but with all the exercises or stretching routines that we do, make sure that you have a healthcare professional examine that area before, especially if you have long-term chronic pain or a severe injury that your spine or your shoulder or any joint in your body is able to withstand these exercises. Now, the first thing we want to do with the shoulder is stretch out the posterior or the back margin of the shoulders, okay? And in order to do that, what you're going to do is you're going to just we'll start off with our left hand. Just put your left hand sort of in front of you like this and take your right hand, put it underneath your elbow. And what you want to do is just bring it straight across your body, okay? As far as you can. And what you're going to feel is all in this area here, you're going to be stretching out the posterior margin of your shoulder girdle. And you're going to feel it straight across the middle. Next, what you're going to do is just hold that for maybe about 10 seconds and then bring it back right in front of you like this. Just let it rest out in front of you. Next, what you're going to do is the same stretch, but you're going to bring your arm slightly up, higher across, like almost making your arm touch your chin. The higher you go, the lower it stretches into the back part of the shoulder girdle. So if Lizette goes higher, it's going to stretch lower. If she goes in the middle, or even that higher, she's going to fall off the camera. But if she goes in the middle, it's going to be across. Next, let's let it relax out this way, and we're going to bring it low, like towards the floor, okay? We're going to stretch it towards the floor, and this is going to stretch higher up on the shoulder girdle. One of the things that I instruct my patients with is that when we're stretching the arm, and remember, Lizette, I showed you this one in the office, you can actually grab a door jamb. Make believe this is a door jamb. You grab the door jamb, you could stretch across, hold it lower, stretch across, hold it higher, and stretch that shoulder area. Another problem, which is very common for people who have shoulder ailments, is to have an impingement in their acromioclavicular joint, which is where the clavicle, which is your collarbone, and the acromion process of your scapula come together. A lot of people will have what's called a rotator cuff impingement or a tear in their rotator cuff, which is a muscle that starts behind your shoulder, comes across underneath the joint between your clavicle, which is your collarbone, and your scapula, which is your wing bone, and the muscle attaches into a point approximately here. Sometimes the muscle or the tendon is torn, but a lot of times it's just impinged or compressed in that area. So one of the things that we do is we try to open up that impingement and by allowing that area to be distracted or opened up. So the way we set this up is you just step on this elastic band and we're going to pull up and you can see the tension in the band. Now you could do this with a weight, maybe a 5-pound weight or a 6-pound weight or a 3-pound weight, depending on how much your shoulder girdle can handle. Now what you want to do is just bend the knee a little bit and allow your body to tilt forward just a bit. And what you're going to do is just make circles. Just circles to the outside, and then circles to the inside. You can make figure eights. Now what all this does, the tension is pulling the shoulder, so what it's doing is it's opening up the joint, okay? And the rotation is just allowing those ligaments and tendons that are holding that area to become more flexible. Now try this, Lizette. Just allow your arm, just hold your wrist tight, but allow your shoulder just to relax. And you can actually feel that space opening up in your shoulder, right? And then you can bring it back up, and then you can just let it relax. This is very important in opening up that shoulder girdle or that joint. Again, a simple impingement, we have a real wonderful procedure we do in our office that actually can open up that joint and allow that shoulder to heal naturally. But in some cases, if you have a confirmed tear in your rotator cuff muscle or your supraspinatus muscle, if there's a confirmed tear, this is not an advisable exercise to do. Okay, again, always have whatever area of your body checked out before you start doing some exercises.